Is your treatment for asthma or an allergic condition working for you? If not, it might be time to consider a biological medication. My name is Tonya Winders, and I am the president of Global Allergy and Airways Patient Platform, and I'm so glad that you've chosen to be with us today. Let's start with taking a look at biological medications. Many medications are produced in a laboratory using a chemical process. They are small molecules and aim to relieve the symptoms you're experiencing, but they may not treat the underlying cause of your health issue. Their structure is simple and easily identified. Biological medications, on the other hand, go deeper. They treat your health concern by focusing on specific cells, proteins, and pathways. They are grown in a laboratory from living organisms such as humans, animals, and microorganisms. They are large and complex medications at the forefront of drug research. New biologicals are constantly being developed. As you consider what medication is right for you, it's important to learn about biological medications. One way to do that is to look at the gap.org Biologicals Toolkit. The next important thing is to talk to your doctor. Today, I'm pleased to be joined by Dr. Yorgancıoğlu from Turkey. Welcome. We will be talking about how to share your healthcare decisions about biological medications with your doctor. First of all, what do you consider when sharing a healthcare decision with your patients?
Thank you very much, first of all, for the invitation. It is a very important issue because we know that in chronic diseases such as asthma and allergy, or sometimes COPD, the relation between healthcare provider, the physician, and the patient is crucial. So we need this relation to be very good established. So patient can discuss the care with their doctor. There are many incorrect information in internet. So patient can come to you with this information and ask you. So we need to look at it. We need to compare the treatment options. And also the culture, the gender, the socioeconomic status of the patient is so important. So we need to deal with the personal values as well as the personal preferences of the patients. So we need to come to a decision together with the doctor and the patient. And this is an ongoing process. When we start a biologic treatment, it takes time, sometimes years. So we need to re-evaluate the decision as the time goes by.
So when a patient comes to you and they want to consider the next step in treatment and perhaps a biological medication, what do you typically discuss?
First of all, I need a good time for my patient because we need to discuss everything. We need to make that the patient ask and had the answers of all the questions that they have in their minds. So I would discuss them with the medications and the treatment options and review what has worked well and what has not worked well, and advise the patient about the treatments, including biological medications that may be appropriate for them. And there are some concerns of the patients about biological treatment. We need to talk about the risks of the treatment and we need to think the advantages of the treatment. We can ask them, are you comfortable getting injections? Do you have transportation to get to the office regularly for treatment? And how much will this cost? And if your security will cover this treatment? Those are very important questions.
Absolutely. Now, Dr. Yorgancıoğlu, do you feel that the outcome of a patient, the success of a patient's outcome is affected by shared decision making?
I do a lot. It's the key of the success is the success of the management of asthma and allergy, because I know and I experience with my patients that if we have a shared decision, the patients feel more confident in the treatment plan and they believe that you support them. And the patient is more likely to adhere and to complete the treatment and more likely to experience less symptoms and a higher quality of life, which is our target.
I couldn't agree more, Dr. Yorgancıoğlu. Shared decision-making is a cornerstone in patient-centered healthcare, and sharing these decisions alongside the patient and doctor can make such a real difference in the lives of patients. Thank you for being with us, Dr. Yorgancıoğlu, and taking the time to make such a difference in the lives of your patients every day. And thank you to each of you for joining us today. The mission of the Global Allergy and Airways Patient Platform is to globally support and empower patients living with allergies, airways, and atopic diseases by protecting their rights and insisting on the duties of government, healthcare professionals, and the general public. GAP's vision is to create a world where patients with allergies, airways, and atopic diseases live better. Thank you.